I'm Dr. Qasim Safa, the Associate Medical Director for Living Donation of the Kidney Transplant Program at Massachusetts General Hospital in Boston. I'd like to welcome you to this educational session about living kidney donation. Kidney donation can make an amazing difference in people's lives, and by watching this video, you're proving yourself someone who's interested in live kidney donation, and I want to thank you for that. Let me start off by pointing out that offering to donate a kidney to someone is an act of extraordinary generosity and kindness. And before we get into the details of this educational presentation, I wanted to pause for a minute to thank you for considering the gift of life. The goal of this educational presentation is to help you understand all aspects of kidney donation, including the risks and the benefits, so that you can make an informed decision about whether kidney donation makes sense for you. If you decide to be evaluated as a kidney donor, we will ask you to sign an informed consent for evaluation that enumerates the risks and the benefits. To understand living kidney donation, it's important first to understand the kidneys, where they're located, what they do, and what happens when they're not functioning well. The kidneys are internal organs that are located behind the abdominal cavity in front of the back muscle, one on each side of the spine. Most people have two kidneys, and the kidneys perform many important functions in the body. The most important functions include removal of toxic waste products from the blood and excretion of those waste products into the urine, regulation of the amount of water and salt in the blood, and production of hormones that travel through the blood and affect other important bodily functions. These hormones include erythropoietin, which regulates red blood cell production, renin, which helps regulate blood pressure, and activated vitamin D, which is important for calcium absorption, bone health, and immune function. When the kidneys are not working normally, we call that chronic kidney disease. There are many signs and symptoms of chronic kidney disease. One of the most common is fatigue. Patients also often report stomach upset, nausea, vomiting, and an unpleasant taste in the mouth and a loss of appetite. Patients may report a change in their urinary habits. They may get up frequently at night to pass urine, or may find that they need to pass urine more frequently during the day. Swelling of the ankles, the feet, the hands, the face is also a common symptom of kidney disease. The bones may not be normally formed, and thus fractures are more common. Muscle twitches, cramps, pain, and weakness are also common symptoms. In severe cases, pericarditis and heart failure can happen, as can confusion, lethargy, and seizures. When a patient's kidney function is no longer adequate to maintain life, that's called end-stage kidney disease. This condition is also known as renal failure or kidney failure. Many diseases can cause end-stage kidney disease. Diabetes is the most common. Hypertension or high blood pressure is another important contributor. In the United States, there are close to 800,000 patients who are being treated for end-stage kidney disease. Approximately 570,000 of these patients are on dialysis, and about 230,000 have functioning kidney transplants. In 2019, more than 130,000 individuals were diagnosed with end-stage kidney disease. More than 100,000 of these end-stage kidney disease patients are on the wait list for a kidney transplant. In the United States, about 20,000 kidney transplants are performed per year. Recipients usually wait somewhere between 1 and 7 years on the wait list for a deceased donor transplant, mostly dependent on blood type. When a patient has end-stage kidney disease, there are two treatments available: kidney transplant, either from a living or a deceased donor, or dialysis. The treatment team and the patient family will discuss which option is best for a particular patient, and that decision can change over time. There are benefits for the recipient to find a living donor. The wait time is shorter. The transplanted kidney is more likely to work immediately. It has a lower chance of rejection and typically will last longer than a deceased donor kidney transplant. For the living donor, there is no medical benefit from donation. For this reason, we make sure the donor evaluation is very thorough to make it very unlikely that the donor has complications related to the donation.